afternoon and welcome back to our next session, Perspectives on Childcare and Developmental Screening, Navigating Power Dynamics, Assumptions of Knowledge, and COVID-19 in a Community Research Project. My name is Becca Bolas and I'll be moderating today's session. A couple of reminders before I introduce our speakers. The first is that we are offering conference captioning services. And so within this session, you'll be automatically provided with the captioning, which is underneath the video stream. If you don't need the service, you can push the pause stop button and that will stop the stream. The second is to please be sure to complete the session evaluation. It's just 4 short questions and your feedback is very helpful to us and to our speakers. And it is required if you're seeking continuing education credits. So with that, I'm now excited to introduce our speakers. We're joined today by Sana Osman and Sarah Lewis from Maine Access Immigrant Network, Cassie Grantham from MaineHealth, Susy Hawes Peoples, and Emilie Swenson from University of Southern Maine, Katie Soucy from Portland Connect Ed. And so with that, I'll turn it over to you, Emilie.
Thank you. So good afternoon, everyone. Thanks for joining us. So that was we have a big, lofty title for our presentation today that we'll hope to get through and touch on all those things. I'm Emilie Swenson and I work with the Data Innovation Project at the University of Southern Maine Cutler Institute. And so I'm going to have folks on our team introduce themselves in just a moment, but I'll just provide a quick overview of what we're going to be talking about and a very basic, the super quick version of what this project was all about. So we'll talk about the project, the findings and recommendations, and then we'll also talk a little bit about our reflection on the process itself and get some updates on what's happened because we were just presenting this report to folks for the first time about a year ago. So there have been some updates since we wrote it, which is exciting. And then we'll take some questions at the end as well. So the project that we're talking about today is something that we did in 2020, and it was a partnership between Data Innovation Project, Starting Strong, Maine Access Immigrant Network, Maine, and MaineHealth. And so this was a collaborative effort. And what we wanted to do was come together to learn a little bit more about immigrant perspectives on childcare and developmental screening. And that came from community interest from Starting Strong, which focuses on early childhood education, and the Developmental Screening Initiative in Cumberland County, which focuses on developmental screenings, of course. And so these two groups were interested in learning more from immigrants in Portland and the Portland community, parents of young children, about these two kind of big topics. And so Data Innovation Project in Maine worked together to develop a protocol for how we might ask parents and families about their experiences. And so we started this project and we had a plan. We were about to implement it in early 2020 and then COVID happened. And so we went from thinking about community focus groups to then doing interviews. And so the Maine community health outreach workers were able to conduct interviews with parents, which was different than what we intended, as I know a lot of research projects and health-related projects that have been talked about throughout this conference. COVID has played a big role in what people were actually able to do. So with that brief intro about what the project was, I'm going to invite our team members here to introduce themselves with their name and their organization and role on the project, and then a word to describe the project from their experience. So I'm going to call on you, and Cassie, I'm going to start with you.
Hi there, everybody. My name is Cassie Grantham. I am the Director of Child Health at MaineHealth, and I had the pleasure of getting to work with this group more specifically on the developmental screening piece, but we do have other work that we did in childcare as well, which was really exciting. And the word that I've been using most often to describe this work is synergy, because we were able to use I think collectively come together around a couple of topics that were of great interest to everyone. And we came from different perspectives, but we're able to really have the ideas and the process really work very well in concert with each other. And so it was very synergistic in a almost informal way, even though we had to have some formality, of course, to make sure that we could work together appropriately. So thank you for having us today.
Thank you, Cassie. And Sana, I'm going to call on you next.
Hi, everyone. Good afternoon. My name is Sana Osman. I'm a community health worker with Maine Access Immigrant Network. And a word to describe this research is personal. For me, I'm a mother first, and even though my children are older now, but childcare was one of the worries at the point of my life. And so this was really personal for me. Thank you for having us.
Thanks, Sana. And Sarah, can I call on you next?
Sure, yeah. Sarah Lewis, project director for this project with Maine Access Immigrant Network. And I'll break the rules and make a hyphenated one. Community-led this project and community design. So I double broke the rules. This project really, the partners that we worked with took into account the importance of listening to the implementation team. And especially during the pandemic, having to roll out this kind of work during a pandemic, it was incredibly crucial to be heard as the people implementing the project. And they worked so beautifully around the way in which our community health workers needed this project to be carried out. So it was beautifully community-led and designed.
Thanks, Sarah. And Katie?
Hi, everyone. My name is Katie Susy, and I'm the director of Starting Strong, which is the early childhood subcommittee of Portland Connected, which is a cradle to career education initiative in Portland. The word I'll use to describe this project is growth. And I think that came from all of the folks who have been involved and the opportunity that we had to listen.
Thank you. And Susy?
Hi, I'm Susy Hawes with the Data Innovation Project at the University of Southern Maine. And Emilie and I were the researchers for this project. We held the research methodology and some of the reporting responsibilities. And the word that I use when I think about this project is flexible, which started on day one and really had to ramp up in March of 2020.
Thanks, Susy. And the word that I'll share is exciting. I think that this project led to some great opportunities for partnership and learning. And one of the reasons why we wanted to bring this to this conference was because we hope that this information can be shared out. I think we learned a lot, and we are excited just to get it out there in the world and get people thinking about it. So with that, I'm going to get us into, it's a little bit blurry, but hopefully folks can read it. This is an example of a question near and dear to this project because it relates to developmental screenings. And this comes from the Ages and Stages questionnaire, which is a commonly used tool. And if folks take a look at that and read the question, and the question for you all and to put in the chat is, what age do you think this question is for? So what age child might we be asking this question about? And I don't know if any chat responses come in, but if any do, if you could share them out with us, that'd be great. And maybe as those are coming in, Sana, oh, go ahead.
Couple guesses for 4.
4, okay, great. And I'm gonna have Sana share a story related to this question, and then I'll let folks know what age it is for.
So for the age of handing a scissors, first of all, I just want to say that for the immigrant community, especially people coming from, I know immigrants come from different places, but especially people coming from refugee camps or people coming from like war-torn countries, scissors and handing a child the scissors is like handing a child a knife. I remember a mother once told me that, why are they asking me about the scissors? If how would I hand my child the scissors? Because child-safe scissors are not available in a lot of these countries, and they haven't used them before, and so nobody would dare to hand their child a knife. So the same thing was thinking about handing a child the scissors. So thinking of a 4-year-old coming from the immigrant community being handed a scissors is not something that's logical to doesn't relate to a lot of the immigrant communities.
Thank you. Yeah, and so this question comes from the 36-month ages and stages, so 3-year-olds questionnaire. So just to put that into perspective of like when kids may use scissors and safety scissors, hopefully. But that's just, it puts into perspective, parents may be wondering, why would you even ask me this question? Because that's dangerous. Why would I be allowing my child to do that? So I think we'll get into this more as we discuss, but these are just some of the areas where we want to create understanding, both from providers who may be administering this and also from families who may be hearing these questions and wondering why they're being asked them. So we are going to, child safe scissors. There we go. So that's a big distinction between a knife and scissors. But one of the things we wanted to highlight here, we're going to be talking, of course, about childcare and developmental screenings, but just since this is a public health conference, that childcare is public health. And when we're thinking about the social determinants of health, we're thinking about early care and early education and how those connections to community influence health as well. So just highlighting that, even though sometimes childcare doesn't always get considered in this light. So I'm going to just share just briefly kind of a quick rundown of a few of the methods which can maybe help you think about what you're hearing. I didn't, Sana and her colleagues at Maine talked with 18 parents and did phone interviews. We were going to do focus groups, but because of COVID, we didn't do that. And we also, Susy and I did a Zoom focus group with some local Portland interpreters and cultural navigators. And we also did a lot of debriefing with the Maine staff after they did their interviews to talk through the process. And I will leave it at that. As we're talking through the results and the recommendations, that's kind of the sample and how the work was developed. The questions that were asked were developed collaboratively between Maine, Starting Strong, MaineHealth, and the Developmental Screening Initiative. We started out with probably 300 questions, as most research projects do, and had to narrow them down to an interview protocol. So that's the intro to the project. And I'm going to turn it over, I think, to Sana and Sarah to talk more about childcare.
Thanks, Emilie. So we conducted these interviews, as Emilie mentioned, and they were all over the phone between me and the other community health workers in our organization. And the primary research question was, what are the experiences, expectations, and needs of immigrants, refugees, and or asylee families in terms of family, friend, and neighbor care for young children? What we learned and the most important qualities that came out of this question were everybody mentioned trust. Trust is, while it was mentioned several times, trust is a quality that may also be interpreted to be embedded within a number of other qualities, like such as safety and acceptance and appreciation of the parents' home culture. So when parents were asked about what their children do during the day and what their ideal would be, trust may play a big role in their decisions. Safety, of course, for all the children. They wanted to make sure that the children are kept in a safe place. Acceptance and appreciations of family home culture, and that comes in the form of support of their child to speak and learn their home language, accept and offer culturally familiar food, connect and understand the children's home culture. And both overt and covert examples of racism were described by parents. So one parent felt that their child didn't get the same treatment, while other described an incident where in a daycare provider told them that their child's behavior would lead to people doing terrorist acts. So these experiences led parents to feel that they did not want their children in these certain daycares, because they did not want to have to deal with judgment. They did not have to deal with discrimination. Finally, our surveyed parents highlighted that engaging in educational activities and socialization with other kids is really important to them in finding the right daycare for their child. Ideally, young children are usually cared for by the mother or other close relatives. So in reality, our participant reported that they either used in-home care or center-based childcare, or split parents, where the parents would work different hours, different shifts. And also they have used sibling care, where an older sibling would take care of the younger kids. The challenges that our parents experienced are mainly the cost of the daycare, the hours of operation, the waiting lists, and how they have to wait, especially daycares that are subsidized or that are lower income people. So this is hard for them to be on a waiting list for a long time. And also racism, unequal treatment. And the main thing that everybody mentioned was the DHHS involvement. It can cause big challenges when it comes to building trust with mainstream systems. This fear of judgment and surveillance has serious repercussions for families and leads to a deep sense of mistrust from parents. This broken relationship can harm both the provider's relationship with the family, but also most likely with the cultural community in Portland. And so the parents had this fear of everything that's done or everything that happens in a daycare would be reported to DHHS and could lead to, there's a lot of stories that you can hear from the community where it could lead to the child being taken away from the family. And so this is a fear that is in the back of every parent's mind. I remember one of the parents I talked to, she said, even if I'm home and my child falls, I'm worried about the DHHS getting involved. And if it is accidentally, that the DHHS is going to get involved and my child is going to be taken away from me. So this would undercut the child's opportunity to learn if parents have this worry all the time. Next slide, please. This is a quote actually from a parent I interviewed, and she said to me, making sure that they don't forget their culture. So my son, who is 6 years old, he asked me once, why don't they speak about Eid? Eid is a Muslim holiday, and they only talk about Christmas. I had to explain to him that we live in a Christian country, and that this is what they celebrate. I feel American kids should know about our culture more. And I remember when I came to this country when I was younger and in school still, kids would ask me, why are you still wearing your scarf? You are in a free country now. You don't have to wear it. They don't know anything about our culture, and I think they should know more. So this is how this parent felt. And this is one of the parents who came earlier in her life, and she kind of went to school here. Part of her schooling was in the United States. And so this is how she felt, and this is how she expressed it. And I will leave for the next slide, I'll leave the recommendations to Sarah to go through. Thank you.
Thanks, Sana. So all of these one-on-one discussions with parents and community members led us to 6 recommendations, which we hope to be building on in the near future with further work in this research. The first recommendation is to improve support for people trying to find childcare that meets their needs. And this includes clear guidance about what people are eligible for. Different immigration statuses mean vastly different eligibility to benefit programs. And that we need mapping on that. If we're not going to change, if we're not going to make everything available to everyone, regardless of immigration status, we need more providers and all of us need to have better resources so that we understand how to help people navigate that map. Clear information about Head Start registration was another recommendation. Support for parents enrolled in educational programs. So while people are taking English classes, for instance, with Portland Adult Education or any other courses, it would be great to be able to offer childcare programming at the actual location so that parents can stay in class. We help, I can't tell you how many mothers we've helped through our organization who have had to drop out of English learning classes because they don't have adequate childcare. Their voucher just doesn't cover it. And we've had to, reach out to volunteers to have folks go to their home and do one-on-one English tutoring. So people want to learn. It's just the system isn't set up for that. Support for families who want educational programming and activities for their children while they're on the Head Start waitlist. Let's not lose the opportunity to teach our kids and to help them develop. Waitlists shouldn't be a reason why they're behind. Middle ground programming. So this is the care that's needed by working parents in between that full day or everyday daycare center programming. So it's folks, parents who are working multiple jobs, two parents who have two different jobs with varying shifts. They need a different type of childcare, and we need to be able to think outside the box a little. Childcare shouldn't have to only be between 7 a.m. and 4 p.m. or 4:30 p.m. We need things that work for working parents. Second recommendation that came out of this work is to increase targeted support to help people open their own licensed home daycare centers. We have a lot of people from our client community who, quite frankly, if they had an easier route to develop their own and run their own daycare center, they would. And wouldn't it be cool if we had French-speaking daycare centers or Somali-speaking daycare centers that many of our American children could learn other languages? But this is one, the targeted support that was requested is with the licensing process. It's still it's still too complex, and we want to simplify it so that more people can access it. The third recommendation, to increase and include more trusted community builders. Or navigator roles, people from a lot of the communities where these kids are living. And this would help build understanding and trust, or working being more engaged with community-based organizations that are run by communities where these children are going to school, or where these children's parents work and live. Diversifying daycare center staff and training existing providers to be inclusive and supportive of different languages and cultures. We all know that childcare is too expensive for almost all working parents who don't qualify for vouchers, and quite frankly, for almost every working parent I know. And we really need to address these issues of childcare affordability. And finally, it's probably not a shock to many working parents on the call today, but paid parental leave was one of the recommendations for 6 months to a year. And now I'll pass it over to
That's me.
my colleague. Thanks.
Thank you. As you can see from these this discussion and these recommendations, I can, as Sarah was alluding to, there are things that are specific to specific communities. And there are also things that are relevant to everyone. And so I think that was some of our learning too, was what are some of the targeted strategies that might be developed in the future? And then what are some of these big picture issues that I think we do hear a lot about, especially with COVID and the challenges with childcare and finding childcare. And I just want to highlight too that the community health workers were doing these interviews in May and June of 2020. And at that point, schools were kind of all over the place. Most kids were home. So I didn't mention this earlier, but some of these calls were an hour long because parents had kids at home and were trying to deal with what the kids were up to and have a conversation at the same time. So just thinking about some of the challenges that come up with research, and also especially COVID, because it had been our intention originally with this project to do focus groups where we could have childcare and activities, and maybe even food to share, which is a very different experience than what ended up happening. So I think just these, as I get into the developmental screenings, just thinking about the amount of time and effort that parents put into these conversations and the community health workers put in to listening, and then also incredibly, because of their roles, thinking about, okay, what supports might this family need at this time, in this challenging time. So just a little bit, again, a plug about the methodology and the process for this. And I'm going to talk a little bit more about the developmental screenings, which our goal here was to look at what are culturally appropriate ways for providers to assess early childhood development in immigrant, refugee, and our asylee communities. And so with these questions, we were really trying to get at what our parents' experiences like, and around developmental screening specifically. And so these were some of the findings that we heard from parents, and some of them were positive and some of them, again, were a little bit more negative and relate to some of the things that Sana shared already. Many parents said that they had positive experiences with screening. So it was an opportunity for learning about their child's development and maybe getting some support around that, which is exciting as a parent. What could my child do? How can I learn more? But then there were also some a little bit more negative or apprehensive feelings about screenings. Families didn't necessarily know, why are we being asked these questions? Maybe they're being asked, the scissors example is a great one. We're being asked something that doesn't make sense to me, and I don't think is a relevant skill. So why are you asking me this? And I think especially when you don't know why you're being asked this series of questions, it makes it hard to be open to those questions about those specific skills. Another thing that came up in the conversations with parents were thinking about the translation. So sometimes tools can be or are translated. So you can get a paper copy in English, you can get it in French, you can get it in Arabic, but is that enough? Is that enough information just to translate word for word? Because there are also cultural conceptions or values that play a role, and it's not just about the words. And the other thing that came up was what's the intention? I think that gets to some of the things that Sana was sharing about experiencing racism in the medical system and worries about DHHS involvement. So if you answer a certain way, is that going to impact your relationship with your provider, with your child? What's going to happen to them, and what's going to happen with this information? Some of the feelings or expressions that came up were feelings of being overwhelmed, worry or fear, embarrassing if you don't know the answer to a question or don't really understand it. And again, leading to that potential lack of trust or mistrust with what's going to happen with the information. Another thing that came up was differing beliefs and expectations about development. We heard from some people that, kids will just develop. There's no need to worry. They'll learn to walk. They'll learn to talk. Like, it'll happen. And so this idea that your child needs to be walking or talking by a certain time was different, because people kind of felt, oh, it will happen. This is something that will happen. Another thing that came up too was the role of interpreters, both the benefits of having interpreters and the potential challenges. So Portland, this area is it's a small city, it's a small state. Communities are small, and so families may feel some apprehension about sharing information because of judgment or worry about privacy of what they share. But it can also be a major source of support, so families feel like they can be heard. One thing that did come up as well was around phone interpreters and how sometimes that can be helpful because they can provide some distance. They're not, immediately in your community, so maybe there's opportunity to open up a little bit more and not worry about that fear of judgment. Parents also describe themselves as their own interpreters, so maybe parents coming together or coming with another relative who could help interpret, and that leading to feeling supported because you were there with someone else and not just alone with the provider. So these were just some of the things that came out of this, and we have a longer report that goes into more details. So these, as we're talking, these are all just touching the surface of that. And then the recommendations piece of this. So thinking about how do we give information to families? Are these questions that, here, fill out this form with no information? Or a recommendation might be that these forms get sent home to parents ahead of their well child visit. So if you're going for your 12-month visit, you get this form in the mail in the language that is appropriate for you, and you can maybe be asked to fill it out. Or at least you get it and then the provider can give you more information when you get to the visit. But then also thinking where could other times for information be shared? Is there an orientation to the doctor's office when a patient signs up as a new patient that they could learn, oh, this is the process that we do. We do this for everyone. And I think that emphasis on universality of the screening process can help with some of those issues of trust, that parents aren't just being singled out, that this is something that providers do with everyone. And then some of the other ideas were to promote family involvement in the process. So really thinking about how do we engage families in what a screening is. How do they learn more? How do you share resources about development? So it's not just like, what can your child do or cannot do, but where might they learn, like, oh, these are some activities that you could do with your child that help to support this, or this is what will be happening in the future or may be happening with your child. And these are times to be concerned if they're not. So giving parents more opportunities to get involved in their child and understanding development. And then related to the interpreter piece, just educating parents about their rights. So what are privacy rules? What's HIPAA? What are interpreter roles? That may help to alleviate some of the issues around that. It may not completely, because again, Portland's still a small community, Maine is a small community, but if people maybe know a little bit more about what interpreters can and cannot do and what HIPAA is, they may feel more likely to share. And then also that parents don't have to participate in these things. This is an option. What are your rights about refusing or accepting a screening? And then what actually are the next steps? If you do accept participation, what will happen? And so for providers to be very clear about that. And then again, considering how these screenings may respect culture and language, and if they do. If they don't, how does a provider address that? There's in the ages and stages, one of the things is like, can your child pick up a Cheerio? But it's like, okay, maybe not everyone eats Cheerios or has Cheerios. And so like, how could you ask that differently? Or the same thing with the scissors. What's the intention behind the question? The intention is to test a child's skills and abilities, either fine motor, gross motor. And so how else might you ask that question? So how can people get creative about learning about a child's development while also respecting their culture? And then good communication with family. So just being able to listen to a parent's concerns about their child or their joys with their child. How does a provider listen to that and engage with families? And this medical system that we live in often As some of the parents commented, as challenges is that visits are very short. And so providers are in and out, but how do we get past that and be able to connect and build a relationship so that you can have that trust between the family and the provider who might be doing the screening. And then finally, a recommendation was to provide training to interpreters to help parents understand screenings. And while we know that the role of an interpreter is to say, exactly what was said back and forth, is there something that interpreters can learn and know about these screenings so that parents, both the interpreter and the parent, can fully understand what's happening and why it's happening? And I guess that also flows into the recommendation around childcare about what's the role of navigators, cultural navigators or brokers in these processes to help everyone understand what's going on. And I think that is that's the end of our slideshow portion, and we're gonna just have a conversation now for a few minutes. Folks from the team sharing some of their experiences and reflections, and then thinking about takeaways and how this work has moved forward since last year. So I'm just going to start with Susy. I know I talked a little bit about the methodology and design, but if there's anything else you want to add about how this project was created and the role of the Data Innovation Project.
Yeah, thank you for going over all of our findings and recommendations so succinctly. I think as we shared in our kind of word of the day at the start, from the beginning of this project, this whole team had a clear sense of collaboration and trust, and really trusting each other's expertise. So although Emilie and I know research at the Data Innovation Project, we don't know these communities as well or as intimately as the community health workers at Maine. And so we really built this methodology around everybody's diverse expertise, which was unique, which is a really unique way to do research. And so our role was to really ground the project in the strong research methods, provide some training and capacity building to the community health workers to actually conduct the research. So before COVID, this was Emilie and I kind of drafting up some materials and then going to the Maine office and sitting down together and taking lots of notes, talking through questions and ideas, and coming up with more questions, having more meetings. Because the original plan, as Emilie talked about, was that the community health workers would be conducting focus groups. So we together developed and refined these questions. And this was especially crucial because the community health workers really had to be bought into this process and understand the reason behind each piece of the research. And since the focus groups were originally going to be conducted in different languages by different community health workers, we had to make sure we were aligned on the essence of each question, even if it was going to be asked in a slightly different way in different groups. We had to make sure people understood the link back to the original research question, as well as the ultimate goals for the community. So we did probably start with 300 questions and had to whittle those down. And then in March of 2020, everything changed for everyone. So we switched this data collection strategy to the telephone interviews. And so in addition to reducing our sample and taking a lot more time for the community health workers, this really wasn't an ideal data collection strategy. As Emilie said, we purposely planned to use focus groups. We knew that focus groups would help to build a sense of trust and really foster dialogue between community members. We planned to share a meal and have childcare. And so the goal was it would be much more of a conversation than an interview. And the interviews went much differently than other interviews. As Emilie talked about, everybody was home together. So as the community health workers were interviewing folks, the people they were talking to, as well as the community health workers, were balancing childcare and school and work all together at home. And so many of the interviews ended up being broken up over multiple sessions because people were busy and juggling a lot of different priorities. But we were all very flexible, and the community health workers and the families who were recruited for this were incredibly resilient. And the interviews became a time for the community health workers to check in with the families more generally also, and Sarah and Sana could jump in on this, but they, in addition to just asking the interview questions, it became a time to just do some, how are you? What do you need? What's happening for you right now? Which was a nice addition that wouldn't have come from just an outside researcher asking these questions. So as a researcher at a university who's used to working within pretty typical research conditions, this project was really an awesome opportunity for all of us. It showed the ways that when we're engaging community members like community health workers in research, it really breaks down some of those typical research and the community being researched barriers. And it was clear I wasn't the expert on so much of this. And so it's been humbling to work with this team who have such a multifaceted expertise. So I'm really grateful for this project personally, professionally, and for the opportunities that it's really shown in terms of both developmental screenings and childcare for Portland and for Maine.
Thanks, Susie. And Sana, as a community health worker who was conducting these interviews, can you share a little bit more about what that experience was like?
This experience has been a lot of things. Number one is flexible. We tried so hard to be flexible because it was the beginning of the pandemic, and so everybody was switching to online, being on Zoom, and the kids are home, as everybody said, and so we tried to work with parents to get an appropriate time so we can talk to them. Sometimes we had to reschedule a couple of times. And when we did the interviews themselves, it took way longer than we expected because we had a lot of interruptions going on with the children being home, our children and their children. So that's the challenge that we all faced. And so we learned how to put the parents first. And when thinking about providing childcare and developmental screening for children, that we should learn that it's the same way that we put these parents first when we did these interviews. And so and the way these interviews conducted from the start to finish followed the pace set by the community health workers, and the funders gave us extra funding to be able to provide case support for our interviewees after we collected the data. We didn't want to just take this data and just run away and not help those people with any needs that they had. So we at Maine tried to find solution to the problems that the parents were having. And one thing to remember that each community health worker of us did the interview in their own language. So for me, it was in Arabic, and thinking that I'm a superwoman, I'm going to be doing the interview over the phone and listening it in Arabic and typing it in English wasn't working for me. So it did not work because my brain does not function that fast, and I'm not a fast typer. So I had to either ask the parent to either record or even just pay more attention, so I can pay more attention and communicate with the parent and listen to them better. So I later on translate these interviews and submit them or give them to Emilie and Susy. So this took way longer. So flexibility was the key, I think, to doing these interviews and being able to conduct these interviews. Thank you.
Thanks, Sana. And so the other thing that I wanted to ask folks about today too, to share a little bit more about how this project has either shifted how you do your work and any important takeaways that you had. And I also know that Cassie, you have some updates too to share about what's been happening since this report. So I'm wondering if you might start with this question and then also share some of the updates.
Yeah, sure. So I think, we started out, I just wanted to say with a concept that quickly just morphed and changed. And I just want to reiterate that, you're thinking one way, and I want to say a very Western approach to research. And Sana and her colleagues and Sarah taught us that there's a lot of different ways to gather information that are equally as valid and potentially even more meaningful in the long run. And so I'm very grateful for that partnership, which and to answer the question, which is continuing. I'm having the opportunity to work with Maine and bring Maine into more of the conversations that us as healthcare providers are having. around, how do we provide good care? What does that look like to people? So it just has awakened, I think, a lot of folks to the opportunity to utilize our community organizations in a much more meaningful way and think about the use and role of community health workers beyond translating materials and translating conversations. In terms of updating folks on sort of where we're at MaineHealth with this work, I think Emilie mentioned specifically, making it known that developmental screening is a universal process for every child. And we actually are talking about normalizing the experience for everyone. So making sure that everybody knows that we're not just asking these questions of certain groups of people. Because I think that, to Sana's point, there are fears and distrusts in certain communities around, well, where is this information going to go and how is it going to be used? And so it's really important for us to do that. So one of the things that we are working on right now is actually with one of our practices, they've been piloting. We're looking forward to getting more information back about this. I was hoping I'd even have more as of today, but they are putting together packets, and not large packets, small packets of information in appropriate languages to go home with families in advance of the whole suite of well child visits that come with having an infant and young child in the United States. There's a lot of visits. You're going to the office a lot. And for some folks, who are coming here, it seems like you're going to the doctor a lot. And that's not always something that's, that is the same elsewhere. And if your child is healthy and well, you're thinking, why am I bothering with this? This is taking a lot of time and effort for me. And so we want to make sure that we communicate why we're asking you to come back so frequently and what we're doing with all the information we're collecting. So these little packets, we're hopeful that they will be helpful. And that came out of the recommendation around sharing as much as we could in advance with families before they came into our offices. We're not very good at that, to be honest, in healthcare. We're not good at preparing people for what they're going to be doing in our offices when they come in to see us. And I think that's a real mindset shift for folks. The other thing I would mention, we were going to put up these posters from the American Academy of Pediatrics, which actually talk about how developmental screening is a universal process. But we weren't able to get their okay to translate them into some of the languages that we want to translate them into. And that was really disappointing. And we're hoping that we can still push that forward, or maybe create something that's extremely similar, but of our own design. And also make it health literacy friendly, because we were looking at having 12 languages on this poster and it got very busy and overwhelming. And so we're hopeful that we can figure out a way of doing that. And lastly, we recognize that visits are short with providers. And so we really need to figure out how to use the whole care team in a better way. And one of the things that we're trialing right now, although not necessarily a direct result of this project, but is very much connected to this work, is we are trialing through a grant project, an early childhood support specialist who will be in a couple of our practices, one being the pediatric clinic at Maine Medical Center, where we actually have a very high volume of immigrant, refugee, asylee families. They are not necessarily multilingual. This specific individual is not multilingual necessarily, but again, it would be an opportunity to bring in potentially an interpreter or whatnot. But this person is completely dedicated to answering and or assisting, and has training, although probably needs more. And we need to bring in outside assistance for this too, but in cultural competence. And so really that person is there to help families understand or ask questions about development, where their child is in the process, to understand where the family is coming from and what their needs are in terms of education or actual physical things, right? They might need a car seat, or they might not necessarily understand why a car seat might be important. And that's what that early childhood support specialist is there for. So we're trialing this out. We're hopeful that it may be helpful to all families, but specifically to families that may not be as familiar with how we run our healthcare visits for really young children. So those are a few examples, and I wanted to make sure we left time for other people to chat. So I'm going to mute myself now.
Thank you. Sarah or Sana, from the Maine perspective, I'm wondering if there's anything else that you want to share about how you do your work, or takeaways that you have, or any updates that you might want to share.
I think just quickly following what Cassie shared, there's this opportunity now, because we see that parents want to know more. They just want to be more engaged with their healthcare provider, and that's what every healthcare system or healthcare clinic dreams of, is to have engaged patients. Don't lose that energy. And I think it's exciting that you have this research has led to the development of a piloted role where that Cassie described. And one thing I'd say is that there's examples around the nation of those types of roles being creating a spoke, I guess, for lack of a better description, and contracting out to community-based organizations that have, walked the walk, that have trust in the community, to help to work with that particular specialist. With different language communities that specialist needs extra help with, because that specialist speaks English. But that specialist is so much more available for folks like, I'm just picturing our community health worker team. If we could have that kind of role in every one of the departments, let's say at one of the hospitals, that'd be amazing, because we'd have somebody we could call, they would get to know us, and we would bring this big medicine thing, which we all have to operate in right now, down to something a little bit more localized. We're just people. And once people get to know the people within their pediatrician's office, they'll probably go a lot more often. They just want to know why they're being asked these questions. And they might want to hear it from perhaps Sana Osman. I had to do this too with my kids, and this is why they're asking this question, because it's going to lead to this opportunity for your kid down the road in this place. Sana, go ahead and add anything there.
You guys said everything I thought of and didn't think of too. So I think that the only thing I would mention is that those closest to the problem are often closest to the solution. So parents need to be put first all the time, and we need to listen to what they need and pay attention to how they want it done and how they want to deal with anything that they have that they want to talk about. And sometimes it takes time for a parent to be more involved, because imagine yourself in an environment that totally new to you, a new language, a new situation, everything is new. So to be able to have the courage to participate, have the courage to talk, have to have your voice be heard, is not easy. So just always keep in mind that we need that parent to participate, and we're going to encourage them to do that. That's the main thing. But the thing that I hoped for too was to be able to interview more people or have a bigger sample, like the focus group we're thinking about, because having just a small sample I don't think it was enough to show like all what these parents who are coming from these immigrant communities need, and how we could. But this was a good sampling of people that we talked to through this research. Thank you.
And there was one question that came through in the chat that I don't know if any of us can respond to, but I think just to bring it up, someone said, how are your findings related to developmental screening assessments being shared in school psychology and teacher training programs, given that school psychologists conduct developmental screenings and sometimes are alerted to the need from teachers? So I think that's a wonderful question. Oh, Cassie, great, has an answer.
So one thing I would say is maybe not directly related to, I think specifically this question is related to the public school system, education system is what I'm interpreting from this. But we, in our developmental screening community initiative group, we do engage directly with early childhood care and educators directly, and so they are constantly talking to us about the screenings that they're doing, as well as child development services, which largely is the group that does a lot of developmental screenings outside of the provider community. And they may be going into families' homes or meeting them at the shelter or going, wherever the family might be. And so we are talking that this research actually directly came out of that group, and we probably could have described that group a little bit better, but it has a lot of individuals on it that are community-based, early childhood-based, school-based. And so I think this was recognized as a need from their perspective. They also would like to have more cross-pollination between healthcare providers and providers of other services in the community in terms of what those screenings results say, so that maybe we can eliminate potential duplication in those different arenas. So it doesn't necessarily answer specifically the question, but we did come at it from a multidisciplinary background.
And we also are sharing the results of this research next week at the Maine Association of the Education of the Young Child. So there will be another opportunity to speak directly with early care providers, teachers about these ideas and recommendations.
So I'm looking at the time. Are there any other questions that are coming in?
We just got one, Emily. It looks like, what are our next steps to implement these suggestions? We need a little more money, honestly. I'm going to be very frank. We would love to do some more work in this arena, but we need some cash because we depleted what we had to be able to do this. And to Sana's point, we'd love to talk to more families and get just additional perspectives. 18 people, we did our very best, and I hope people will commend us for the massive undertaking that was the 18 interviews that Sana and her colleagues conducted. But we really would like to do more. And now we know how to be safe in groups, and we can do certain things that we couldn't have done a long time ago. And then the implementation piece, again, within my organization, we're trying to move this forward, but it's not something that's necessarily funded by the healthcare system. So we have to look for some outside sources of funding as well. So I like to be blunt when it comes to those kinds of things. We need some more money.
And Katie, I don't know if you want to say anything about the ARPA funds and the conversations you're having.
Sure, we've really used the recommendations from this report in all of our policy and advocacy work in the past year. I think you have to be living under a rock to not realize that childcare has really kind of risen into that realm, and there's a lot of folks paying attention. So we've really tried to center these recommendations and all of that work, and we will be talking about that more next week at the Early Childhood Conference. We tried to keep this presentation more centered on the developmental screening results, but there's a lot of work happening as a result of the recommendations made around the childcare piece as well.
Thank you.
And Emilie, did we put a link to the report in the chat for those who would like to read the report?
We can, I think.
Which is a lot to ask you because you're also like running all of us. So
maybe Susy can help me with that.
Yeah, the link. So at the bottom of the presentation, it says documents. And so that's a link to our PDF presentation. And on the last slide, there's a direct link to the report.
Perfect.
Thank you.
Thank you. And that's 2:30 right there. So unless there's any other questions, I guess we can wrap it up. Any other questions in the chat?
There are. Thank you all. Thank you. This was a great discussion. I learned a lot. And there were some really positive comments that were in the chat, just quickly to share those with you. There was acknowledgement that it's so essential to conduct this type of community research with trusted partners prior to designing programs, and acknowledgement and thanks for setting this example. And then thanks for emphasizing how much mental labor and time it takes to do multilingual work. It's a great reminder for those of us who work with multilingual staff who document in English but work with families in other languages to build time and support into their schedules and caseloads. So, some thoughtful questions, and I think some, positive reinforcement and reaction to the incredible work that you've all done. So thank you very much for your presentation, and thanks to everybody who joined us today. Just a reminder to please complete the session evaluation, and we'll be back here in just about 10 minutes for our next session, community-based wastewater testing for SARS-CoV-2 in Yarmouth, Maine. And with that, we will end. So thank you.
Thank you.